edition of Africa Today, and in this edition of the program we will review some reports from the African continent, and we start from Somalia, as Somali President denounced Ethiopia, saying Addis Ababa does not accept his country's sovereignty. Earlier this year, Ethiopia signed memorandum of understanding with the Somalilands to lease 20 kilometers of coast for 50 years. The details follow.
Somalia's President Hassan Sheikh Mohammed has accused Ethiopia of not accepting his country as a sovereign state. During an address to the nation, he said Ethiopia refuses to recognize Somalia as a sovereign neighboring country. He said until it recognizes the sovereignty of Somalia, Somalia cannot talk about a sea or any other thing. Ethiopia violated international law. Earlier this year, Ethiopia signed a memorandum of understanding with Somaliland to lease 20 kilometers of coast for 50 years. That would give Ethiopia, one of the world's largest landlocked countries, long sought after access to the sea. Somaliland, which unilaterally declared independence from Somalia in 1991, has said Ethiopia in return will become the first country to formally recognize it, a step Addis Ababa has yet to confirm. The US, the EU, China, the African Union and the Arab League have all called on Ethiopia to respect Somalia's sovereignty. Turkey is coordinating indirect talks between Somalia and Ethiopia, with Turkish Foreign Minister Hakan Fidan citing notable progress after a second round of talks last Tuesday. A third round is planned for September 17, also in Ankara. With 120 million people, Ethiopia is the second most populated country in Africa. It has been seeking an outlet to the Red Sea ever since losing it in 1993, when Eritrea declared independence after a decades-long war. Somaliland, which is relatively stable compared to the rest of the Horn of Africa region, has its own institutions, prints its own money and issues passports. But it is poor and isolated because of the absence of any international recognition, despite its strategic location on the strait to the Red Sea and the Suez Canal.
And the African Development Bank said Malawi has received an insurance payout of $11.2 million to deal with drought caused by the Nino weather phenomenon. Malawi, which is already one of the world's poorest countries, has had its food supply ruined by the drought, declaring a state of emergency in March, with the food crisis hitting 23 of its 28 districts. Details follow.
The Malawian government has received an insurance payout of $11.2 million for a crippling El Nino-linked drought that led the southern African nation to declare a state of disaster earlier this year. The payout was given to Malawi this month, the African Development Bank said on Monday. Malawi had a drought insurance policy through the bank and the African Risk Capacity Group, an agency of the African Union. The funds will support food assistance to around 235,000 households in some of Malawi's hardest hit regions, and also help with direct relief payments to more than 100,000 households. The African Development Malawian President Lazarus Chakwera said the payout was a lifeline for the vulnerable populations. Malawi, which is already one of the world's poorest countries, has had its food supply ruined by the drought, which has been attributed to the El Nino natural weather phenomenon that lasted a year before ending in June. The country declared a state of emergency in March and said there was a food crisis in 23 of its 28 districts. Crops have failed across the region after El Nino brought below-average rainfall between November and April. Tens of millions of people rely on small-scale agriculture to feed themselves and make a living across southern Africa. Southern African bloc SADC said at a heads of state summit in Zimbabwe this weekend that around 17% of the region's population, approximately 68 million people, are in need of help because of drought.
And Egypt has tightened the health precautions at entry points after the World Health Organization declared Mpox a global health emergency. Cases are soaring in Africa, especially in the Democratic Republic of Congo, as the Central African country awaits vaccines from the United States and Japan. More in the following report.
Egypt has stepped up health precautionary measures at all airports, seaports and land crossings after the WHO declared Mpox a global health emergency. The statement was made by the country's Ministry of Health and Population on Thursday. The Health Ministry said it has implemented preventive measures at all points of entry in line with its strategy to prevent the entry of infectious diseases to the country. The ministry added that quarantine departments have been placed on high alert and are taking precautions against the virus. WHO Director General Dr. Tedros Adhanom Ghebreyesus has assessed that the rise of Mpox in the Democratic Republic of the Congo and its spread to more African countries represents a public health emergency of international concern. On Wednesday, the WHO declared a global public health emergency for the second time in 2 years due to the virus outbreak in the DRC that has spread to surrounding African nations like Burundi, Central African Republic, Kenya and Rwanda. The monkeypox virus causes full-body lesions. It spreads by close contact, primarily through direct interaction with skin rashes, contaminated clothing or bedding, or respiratory droplets from an infected person.
And to shed more light on the Mpox virus, we are joined over the phone by Dr. Islam Anan, a lecturer of health policy and health economics. Good afternoon. Yes, good afternoon, Dr. Islam.
Good afternoon. Happy to be with you as usual.
So, sir, how do you weigh the danger of Mpox on global health?
Okay, to start with, it's not a new virus, and as all the reports are mentioning, this is the second time that Director General Dr. Tedros Adhanom assessed in the rise of monkeypox, or what we call now the Mpox. And as what happened in 2022, the spread was actually at the DRC, Republic of Congo. And for the second time, we are arriving at FEC. The FEC is the Public Health Emergency of International Concern. So, talking about the Mpox and knowing that it's spreading for like 10 years now, the measuring of FEC and why it's a public health emergency is because there's a lack of supply chain and of global assistance to the African continent for that matter. The second one is we are facing a mutant and a new variant from Mpox. It's not like the one that actually raised the concern in 2022. So having a variant, a mutant, and having a lack of assistance from a global perspective, both are actually the reasons to raise it to a FEC level, especially that we do have this year 500 death toll, which is a significant percentage than what happened in 2023, for example. And we are facing currently 15,000 injuries and incidents, and it's currently spreading outside of Congo and outside even of the African continent.
So, sir, how is Mpox transmitted?
So Mpox, it's a virus that's actually what we call can be transmitted from animal to human. We call it a zoonotic virus. So dealing with infected animals will be leading to an infection. Another thing, the human-to-human transmission is not that common. However, it's there. And it is transmitted either by touching the blisters. You know, the symptoms, it starts with like a flu-like fever. And then we do have what's called the lesions. And the Mpox and the painful rash happening from it, it can be very infectious. So if someone is actually touching the lesions on another person's skin, who will be infected. Another thing is the fluid, the body fluid, but it needs a very close contact for that. So these three ways, it causes the infection between a human-to-human transmission. However, we still have a slow rate of transmission between human and that to human, and that's why the Ministry of Health in all the region and our Ministry of Health and the WHO declared that it will be very hard for an Mpox to be a pandemic one day, like what happened to COVID, for example, where the rate of transmission were actually 1 to 15. So one infected person can infect 15 healthy individuals. For Mpox, it's still, you need 2 infected to infect 1 healthy individual. So there will be no exponential growth in infections, but it can be contained within a couple of months. However, on one condition, that there is a global assistance to supply the African continent with the vaccines necessary and with the healthcare systems service providing and tools necessary to actually heal, especially the younger age and the senior citizens there.
So, sir, is there a specific vaccine for Mpox, or it is the same of that of chickenpox?
So it was actually the same vaccine of the smallpox. If you remember back in the 80s, and anyone was actually born in 80s or before that,
yes,
he got his shoulder smallpox vaccine mark, this mark that we have in our shoulders. If so, we are actually protected from Mpox. So same smallpox vaccine will be still effective by 85%. Currently,
so you mean that, sir, sorry for interruption, you mean that anyone who got the chickenpox vaccine is safe to some extent?
The smallpox. If anyone actually took the smallpox vaccine, but it stopped, yeah, so anyone born after 1985, we stopped the smallpox vaccine because it actually got zero incidence. We are safe by 85%. Currently, we do have 2 approved vaccines from the FDA. Both of them were actually smallpox vaccines, and we just developed and made some innovation on top of that. And now currently it's indicated for Mpox and currently very effective. However, we do have a huge problem in supply chain. To tell you, for example, in terms of numbers, we do need 10 million jabs for Africa, 10 million shots. And this is a very low number if you compare it to COVID. We were actually supplying billions of jabs. However, we do have currently in stocks 200,000 only out of the 10 million that will be distributed in Africa in October. So we'll be even waiting for another month till the vaccines are actually supplied and distributed across Africa. So that vaccine is approved, it's there, but it's not in Africa currently, unfortunately.
So, sir, if a person got infected with smallpox or chickenpox, can he get an infection again by Mpox?
Yes, it's a different. Although it's within the same family, but it is different. And most of our children took the chickenpox vaccine, and the parents took the smallpox vaccine. But still, we do have a probability of the reinfection. But if someone is actually infected by Mpox, it will be very hard to get reinfected by Mpox.
Yes, okay. So if we talk about the preventive measures against the disease, can you tell us more about them?
So we do have on a country level and on a personal level. So on a country level, and that's what the Minister of Health actually took, is to prepare all the airports in Egypt for all the coming to be checked for temperature, and if suspected to be quarantined and tested, and we do have the PCR testing. Yes. Another thing is to make sure that all the hospitals in Egypt are actually acquainted with diagnostics. They can deal with cases if there is any case. So far there is no cases, which is the education and awareness. And the third one, on a personal level, we need to make sure that we are actually leading a hygienic public health perspective routine, which is similar to COVID. If we can remember during COVID, if I'm going to a place where there is a high percentage of Mpox, for example, which is like airports currently, the place that we need to be cautious from, because we do have people from all around the world in a very small place, and it's a very fenced one or closed one. And secondly is to make sure that if I have any symptoms, to go directly to diagnostics of the hospital to make sure that I'm not having any, for example, not even necessarily Mpox. I don't have a certain virus that I need to take care of to begin my treatment. Especially I'm talking regarding people with chronic diseases, people with diabetes, people with hypertension, dyslipidemia, obesity, and senior citizens above 65. These are the vulnerable populations that we need to take much care during dealing with others.
So at what stage it is contagious? Which stage of the virus? Before it shows on the skin, or after, or in the recovery period, at which stage it is more contagious?
That's a very good question. So it starts with high temperature and fever, and then some lymph nodes enlargement. Fatigue, for example, it's like a flu-like symptom. This will be for 2 or 3 days. After 2-3 days, 4 days, the skin lesions start to arise. It's all over the full body one. And the person will be contagious once he got symptoms. At first, there is low viral load. So during the first 2-3 days, we do have low viral load. So the probability of infection is very low. But when the skin lesions are actually there, the contagious probability is very high.
Okay. Okay, I'd like to thank Dr. Islam Anan, Lecturer of Health Policy and Health Economics. Thank you, sir, for being with us. And by that, dear viewers, we come to the end of today's edition of Africa Today. Thank you for watching.